So I chose to do my etiology project on tetanus. I chose this because it's a disease that most people have heard of, but many people don't actually know much about how it works. A lot of people, including me, have probably been told that stepping on a rusty nail can cause tetanus, but I wanted to learn more about what it does and how it affects the body. So these are the classifications of Clostridium tetani. We're just going to be talking about the species Clostridium tetani, which I would just refer to as C. tetani for the presentation. C. tetani is a gram-positive rod-shaped bacterium, and when it's viewed under a microscope for a gram stain, it usually appears as pink-colored with green-colored spores. One of the most important characteristics of C. tetani is that it is an obligate anaerobe. This means it cannot grow or reproduce in an environment where oxygen is present. Instead, it thrives and grows in places with very little oxygen, such as a deep puncture wound or damaged tissue. This explains why deep wounds, like stepping on a rusty nail, are much more likely to lead to tetanus than a shallow cut would. C. tetani also has the ability to produce endospores. Endospores are dormant, highly resistant structures that allow the bacteria to survive harsh environmental conditions. They can withstand extreme temperatures, extreme heat, and many disinfectants. Because of this, C. tetani spores can survive in the soil for many years before they ever infect a human. Spores are incredibly important because they are actually the infectious form of the bacteria. When the spores enter the body through a wound and encounter the low oxygen conditions they need, they thrive and germinate and become active, and once active, the bacteria begins producing the toxin responsible for tetanus. Another characteristic of C. tetani is that its bacterium has flagella, which are long, almost hair-like structures that allow it to move. The flagella help it move through the tissue once it becomes active. When looking at Clostridium tetani under a microscope, it almost looks like a drumstick because the endospores form at one end of the cell, causing it to swell. It has a very unique appearance of almost like a drumstick. This shape is one of the easiest ways for a microbiologist to recognize that it is Clostridium tetani. Tetanus is a serious bacterial disease that affects the nervous system. Unlike many bacterial infections, the symptoms of tetanus are not caused by the bacteria spreading throughout the body. Instead, the bacteria usually remain near the original wound. What actually makes tetanus dangerous is the powerful neurotoxin it produces, which is called tetanospasmin. Once the bacteria becomes active inside a wound, they begin producing tetanospasmin. This toxin is released into the surrounding tissue and enters the nerve endings. From there, it travels along the nerves until it reaches the brain and the spinal cord. This process can take several days for it to actually reach the brain and the spinal cord, which is why symptoms usually don't appear immediately after an injury. They usually appear after a week or so. Normally, our nervous system has a balance between the signals that tells the muscles to relax and the signals that tell the muscles to contract. Certain neurotransmitters act like the body's natural brakes, and they prevent the muscles from contracting continuously. But with the tetanus toxin, it actually blocks the release of those neurotransmitters, and without these brakes, the muscles receive constant signals to contract, but no signal telling them to relax. This is why people with tetanus experience severe muscle stiffness and painful muscle spasms. Tetanus is not contagious like the flu or COVID-19 would be. It cannot spread from person to person through coughing, sneezing, touching, or sharing food and drink. Instead, tetanus occurs when the spores enter the body through a break in the skin. Bacteria are naturally found in the environment, especially in soil, dust, and the feces of animals, especially farm animals like horses, cattle, pigs, sheep, and these spores can survive in the environment for many years because of the tough protective coating of the endospores. When someone gets a cut, puncture wound, burn, crash injury, or even an animal bite, these spores can enter the damaged tissue. The rusty nail misconception is that the rust on the nails is what causes the tetanus, but in reality the rust is not what causes tetanus. The danger comes from the fact that the objects like rusty nails are often found outside in the dirt, and that's where they become contaminated with the soil containing C. tetani spores. Deep puncture wounds, like stepping on a rusty nail, are especially dangerous because they create an environment with very little oxygen, and since C. tetani is an obligate anaerobe, which means it cannot survive in oxygen-rich environments, these deep wounds provide the perfect conditions for the spores to thrive and germinate into active bacteria. Once the spores germinate, the bacteria begin multiplying near the wound and start producing that neurotoxin called tetanospasmin. The bacteria themselves usually stay near the wound and they don't spread throughout the body like other infections. Instead, the toxin enters the nerves and travels towards the spinal cord and brain, where it begins interfering with the normal function of the nervous system. One of the first symptoms that most people notice is lockjaw. This happens because the muscles that control opening and closing the jaw become locked in a constant state of contraction. A lot of people with tetanus often find it difficult or even impossible to open their mouths, making speaking, eating, and drinking difficult. As the disease progresses, muscle stiffness spreads from the jaw to the neck and the shoulders. A lot of people describe their muscles as feeling super tight and rigid. The stiffness gradually spreads into the chest, abdomen, arms, and legs. The hallmark symptom of tetanus is muscle spasms. These spasms can occur without warning, or they can be triggered by things like loud noises, bright lights, or something as simple as being touched. They can last for several seconds or minutes, and they're often super painful because the muscles are contracting with a tremendous amount of force. As the muscles in the throat become affected, patients begin to develop difficulty swallowing, which is called dysphagia. Even swallowing saliva can become painful, and this can increase the risk of dehydration and choking. Another telltale sign of tetanus is rhesus sardonicus, which is a lot of the time referred to as the tetanus smile. It's an abnormal facial expression caused by the muscle spasms pulling the corners of the mouth up into what looks like a forced smile, and it's a sign of severe muscle rigidity. A lot of patients also develop intense back arching, where these spasms are so powerful they can sometimes cause the bones to fracture or the muscles to tear. Patients may also experience fever, excessive sweating, a rapid heart rate, and high blood pressure because tetanus can interfere with the autonomic nervous system, which controls the automatic body functions like heart rate, blood pressure, and sweating. So tetanus cannot be diagnosed with a laboratory test. Instead, doctors have to diagnose tetanus based on the patient's symptoms, medical history, and a recent history of an injury or a wound. This is because there isn't a laboratory test that can confirm tetanus, and by the time the symptoms appear, treatment needs to begin almost immediately, so doctors cannot wait for test results before starting care. During the physical exam, the healthcare providers looks for the classic signs of tetanus, like the lockjaw and muscle stiffness. They will also ask questions about the patient's vaccination history, since people who are unvaccinated or are overdue for a booster are at a much higher risk at developing tetanus. Once tetanus is suspected, treatment begins as quickly as possible because it is considered a medical emergency. The first step is wound cleaning. During the process, doctors remove the dirt, dead tissue, and any foreign material from the wound or cut. This is important because it helps remove the bacteria and creates an environment that's less favorable for them to continue growing and producing toxin. Patients are often given tetanus immunoglobulin, or TIG. This medication contains antibodies that help neutralize any toxins in the body, but it can only neutralize the toxins that have not yet attached to a nerve cell and have started going to the brain. Patients are also treated with antibiotics that can kill the toxin and stop them from producing more toxin. A lot of patients are also given muscle relaxants or sedatives to help stop the painful muscle spasms. A lot of tetanus patients are admitted to the ICU because the muscle spasms can affect the muscles used for breathing, and a lot of them have to be put on ventilation because their body cannot continue breathing for them. The most effective way to prevent tetanus is through routine vaccination. Children receive the DTaP vaccine, which protects against diphtheria, tetanus, and whooping cough. As children get older, they'll receive the Tdap booster, and adults should continue getting a booster every 10 years. These booster shots are important because the immunity decreases over time. Even if someone got their childhood vaccines, they can still be susceptible to tetanus years later if they don't stay up to date. Another way to prevent tetanus is through proper wound care. Any cut, burn, or scrape should be cleaned thoroughly with soap and water, and dirt, debris, or any foreign material should be removed. Deep or contaminated wounds should always be taken to the hospital, especially if the person's vaccination status is unknown or has been more than 10 years since their last booster. Thankfully, tetanus is now considered a rare disease in developed countries. It continues to be a big issue in less developed countries around the world, especially in areas that have limited vaccines and healthcare. But thanks to routine immunization programs, the number of cases have decreased dramatically in many countries, but the disease has not been fully eliminated. Tetanus remains most common in developing countries where access to vaccines, healthcare, and clean childbirth practices may be limited. One serious form of the disease is neonatal tetanus, which affects newborn babies, which can happen when the umbilical cord is cut with unsterile instruments or when the mother was not vaccinated before giving birth. Fortunately, vaccine programs for pregnant women and improved medical care have greatly reduced these cases in many parts of the world. Even in developed countries like the United States, tetanus still occurs. A lot of the cases are in adults who were never vaccinated or haven't received a booster shot in many years. Older adults are especially at risk because immunity decreases over time if booster vaccinations aren't maintained. Tetanus isn't treated quickly enough. It can lead to life-threatening complications. The most common cause of death due to tetanus is respiratory failure, which occurs when the muscles responsible for breathing become so rigid that the person can no longer breathe on their own. Other complications are broken bones, pneumonia, irregular heart rhythms, unstable blood pressure, and damage to the muscles caused by repeated contractions. Recovery can take weeks or even months for the toxin to fully leave their system, and some patients require prolonged hospitalization and rehabilitation before they regain normal muscle function.